Today I will talk about migraine, how we diagnose, what are the common trigger factors for the headache, and how can someone reduce the risk of headache. So as you know, migraine is the commonest cause of headache in the world, and the common symptoms are headache which can be one side or it can affect the entire head. And along with the headache, people also have accompanying symptoms like nausea, which is a feeling of vomiting or actual vomiting, and the headache can get worse with exposure to bright lights or noise. And typically the headache in a migraine person lasts for more than 4 hours, but usually less than 72 hours. And if these attacks occur repeatedly over a period of time, then we are fairly sure that we are dealing with migraine. So what are the common triggers for a migraine? So the common triggers are, one is lack of sleep. So optimum sleep duration is 7 to 9 hours. So those who sleep lesser than 7 hours or say even shorter than that, they have a higher risk of getting migraine attacks. And even sometimes oversleeping for more than 10 hours can trigger migraine attacks. Second is fasting, delaying meals or irregular meal timings can also trigger migraine. Stress, which can be work-related stress or any other stress, can also trigger migraine attacks. And people who exercise, so even over-exercising or which can trigger migraine. So each person, the trigger for migraine may be different. It's not the same. In some it can be exposure to bright light, road journeys, or even some foodstuffs. So even the foodstuffs are not uniform. Some can report getting a migraine attack after say having Chinese food, cakes, chocolates, cheese, or it can be anything, sometimes strong perfumes or any other smells. So each person, as I said, they have a different trigger. In women, the few days before periods and even the first 1 or 2 days of periods, the headache frequency could be higher. And typically in women, during pregnancy, the migraine severity and the frequency reduces. And that's a good news. Now, since we have seen these risk factors which can trigger migraine attacks, so what can you do to lower the frequency of headaches in a migraine? So number one is sleep adequately, which means 7 to 9 hours of sleep. Second is to have meals on time and avoid fasting. And third is, if you are going through stress, then try to manage, try to reduce it. And fourthly, exercise is definitely useful because those who don't exercise also have a higher frequency of migraines. But you may need to find the right amount of dose which is suitable for you. So which means if you're a runner and you get headaches at say 8 kilometers of run, you could try running a shorter distance of say 5 to 6 kilometers. It may work for you. Similarly, if you're running at a higher pace which triggers migraine, you could lower your pace and see. Those who do workouts, if you work out for say 1 hour or 1.5 hours and get the headaches, try working out for shorter duration, and then you'll be able to find that sweet spot which is helpful and doesn't trigger your migraine attacks. And also if you have certain foodstuffs that bring on migraines, then try to avoid them. So these are some of the common things one can do, and you'll be happy to note that almost say 50% of people could lower their headache frequency by following these steps. But a group of patients, despite following these factors, they may not be able to lower their headaches frequency, and such people require medications. Consult your doctor, and they are good and effective medications which can help you lower the headache frequency. And now even if the medications don't work, then there are normal medications do not work. There are other treatment options, like we have neuromodulation which can be helpful, and then there are once in a month injections which are available. So discuss with your doctor so that these treatment options can be discussed.